Hello, and welcome back to Everyday Speaking Lab. Today, we are practicing English for a visit to the doctor. You will learn how to describe simple symptoms, answer basic questions, and explain how you feel. Listen carefully, say the important phrases with me, and imagine that you are really speaking with a doctor. Ready? Let us begin. When you visit a doctor, you usually need to explain what is wrong. Maybe you have a headache. Maybe your stomach hurts. Maybe you have a cough or a fever. The doctor may also ask when the problem started, how you feel, and if you are taking any medicine. You do not need complicated English. Simple, clear sentences are enough. For example, I have a headache. Or, my throat hurts. These short sentences can communicate important information. Let us build the vocabulary you need. First, the word symptom. A symptom is something you feel when you are sick. For example, a cough is one of my symptoms. Say it with me. Symptom. Good. Now, headache. A headache means pain in your head. You can say, I have a headache. Your turn. I have a headache. Next, sore throat. A sore throat means your throat hurts, especially when you speak or swallow. For example, I have a sore throat. Say it slowly. I have a sore throat. Very good. Another common word is cough. A cough is the sound you make when your throat or chest is irritated. You can say, I have a bad cough. Now try it. I have a bad cough. Next, fever. A fever means your body temperature is higher than normal. For example, I think I have a fever. Say it with me. I think I have a fever. Now, stomachache. A stomachache means pain in your stomach. You can say, I have a stomachache. Or you can simply say, my stomach hurts. Both are useful. Let us practice the second one. My stomach hurts. Good. Another useful word is dizzy. If you feel dizzy, you may feel like you are moving or losing your balance. You can say, I feel dizzy. Your turn. I feel dizzy. Now, tired. You probably know this word already. When you are sick, you may feel very tired. For example, I feel tired all the time. Say it naturally. I feel tired all the time. And one more important word, pain. Pain means something hurts. The doctor may ask, where's the pain? And you can answer, the pain is in my back. Good. Now let us use this vocabulary in complete phrases. A very useful phrase is, I do not feel well. Listen again. I do not feel well. This is a simple way to begin explaining your problem. Imagine the doctor asks, what is wrong? You can say, I do not feel well. I have a headache. Now say that with me. I do not feel well. I have a headache. Excellent. Here's another useful sentence. My throat hurts. Once more, slowly. My throat hurts. You can also say, my throat hurts when I swallow. Listen to the parts. My throat hurts when I swallow. Now together. My throat hurts when I swallow. Your turn. Good. Another important phrase is, I have had this pain since yesterday. This sentence tells the doctor when the problem started. Listen again. I have had this pain since yesterday. For basic English, you can also use a simpler sentence. The pain started yesterday. That is very clear. Say it with me. The pain started yesterday. You can change the time. The pain started this morning. The pain started 2 days ago. Now you try. The pain started 2 days ago. Good. The doctor may ask how strong the pain is. You can answer, the pain is mild. That means the pain is not very strong, or the pain is very strong. Say both. The pain is mild. The pain is very strong. Another useful phrase is, it hurts here. This is very helpful when you can point to the place that hurts. It hurts here. Simple and effective. You may also need to talk about medicine. You can say, I'm taking medicine for my headache, or I'm not taking any medicine. Practice that second sentence. I'm not taking any medicine. Very good. Now, let us practice some questions you may hear at the doctor. I will ask the question, then you will hear a possible answer. What seems to be the problem? I have a sore throat and a cough. Now imagine the question is for you. What seems to be the problem? Your turn. You can answer with one or two symptoms. For example, I have a headache and I feel tired. Good. Here is another common question. When did the symptoms start? The symptoms started 2 days ago. Again, when did the symptoms start? The symptoms started 2 days ago. Now try a different answer. The symptoms started this morning. Excellent. The doctor may ask, do you have a fever? Yes, I think I have a fever. Or, no, I do not have a fever. Your turn. Do you have a fever? Answer yes or no. Good. Another question. Where does it hurt? My stomach hurts. Or, my back hurts. Listen again. Where does it hurt? My back hurts. Now answer with a different part of the body. Where does it hurt? Your turn. Very good. The doctor may also ask, do you feel dizzy? You can say, yes, I feel a little dizzy. Or, no, I do not feel dizzy. Let us practice the first answer. Yes, I feel a little dizzy. Good. Here's another useful question. Are you taking any medicine? Yes, I am taking medicine for the pain. Or, no, I am not taking any medicine. Your turn. Are you taking any medicine? Answer in a complete sentence. Excellent. Now let us put everything together in a short conversation. Imagine that you are at the doctor. You are not feeling well. The doctor begins. Hello. What seems to be the problem? You answer. I have a sore throat and a bad cough. The doctor asks. When did the symptoms start? You say. They started 2 days ago. Then, do you have a fever? You answer. Yes, I think I have a fever. The doctor asks. Are you taking any medicine? You say, no, I'm not taking any medicine. And the doctor says, okay. Let me check your throat. That is a simple and realistic conversation. Notice the useful phrases. What seems to be the problem? I have a sore throat. When did the symptoms start? They started 2 days ago. Are you taking any medicine? These questions are common, and your answers can be short and clear. Let us do one more practice. This time, imagine you have stomach pain. I will ask the questions. You answer before you hear the example. What is wrong? Your turn. I have a stomachache. Good. When did the pain start? Your turn. The pain started this morning. Is the pain strong? Your turn. Yes, the pain is very strong. Or, no, the pain is mild. Are you taking any medicine? Your turn. No, I am not taking any medicine. Excellent work. Before we finish, let us review the most important language from today. You learned headache, sore throat, cough, fever, stomachache, dizzy, tired, and pain. You can now say, I do not feel well. I have a headache. My throat hurts. My stomach hurts. I feel dizzy. The pain started yesterday. The pain is very strong. And I am not taking any medicine. You can also understand questions like, what seems to be the problem? When did the symptoms start? Where does it hurt? Do you have a fever? And are you taking any medicine? These simple sentences can help you communicate clearly during a basic visit to the doctor. Keep practicing them aloud. The more familiar they feel, the easier they will be to use when you need them. Great job today. Thanks for spending these minutes practicing your English with me. Take care, keep speaking, and I will meet you in the next Everyday Speaking Lab.